Good morning. Safety topic of the week. Preventing the spread of COVID in the workplace. From the BLR, and again, everyone will be sent a copy. Talk discusses the preventive spread, including how the disease is transmitted, symptoms of COVID, and ways to stay safe and healthy. Unless otherwise required by federal, state, and local, tribal, and territorial laws, rules, and regulations, many employers no longer feel they need to take steps to protect the fully vaccinated workers who are not otherwise at risk from COVID-19 exposure. However, the Toolbox Talk reflects the latest guidance from the Occupational Health and Safety Administration, OSHA that is, which recommends employers to allow a multi-layered approach to keeping both vaccinated and unvaccinated workers safe. And they also look for a policy. So we're not out of the woods yet, even though a lot of us, including me, sometimes want this thing to just go away and not have to talk about it, but it still comes up from OSHA. Although it recommends controls be tailored to specific workplace, it also recommends that employers require rather than encourage employees to receive a vaccine. Remember, recommended. This guidance focuses on hygiene practices in a workplace that can protect workers who are unvaccinated or otherwise at risk. And what's the bottom line? Okay, the bottom line comes down to this. What should we have on hand? Sanitizer, a good thing. Disinfectant, cleaning products to use, whether it's a facility or whether it's in a construction vehicle. Emergency preparedness and plan, if you will. Facility policy that requires employees to be vaccinated and receive regular testing. Remember, encouraged. Items for attendees to consider during our talk, all right? How does it spread and protect yourself? Here's my message. COVID-19 is a respiratory illness caused by a virus in a group of viruses known as coronavirus. Other coronaviruses include Middle East Respiratory Syndrome, or MERS, M-E-R-S, and Severe Acute Respiratory Syndrome, or SARS, S-A-R-S. Most cases of COVID-19 are mild, but in some, can become serious and even fatal. Therefore, it's important to take the steps to prevent the spread of infection. All right? So, what are the simple messages? All right? If you got a fever, cold, runny nose, shortness of breath, get tested. Wash your hands often. And it gets more detailed in the message I'm going to send you. Wash, avoid, sanitize, and hold. Okay? So, wash your hands with soap and water for at least 20 seconds. That's a recommendation. Avoid close contact with other people who might be sick. What else do I want to tell you? Sanitize in accordance to employer procedures. Surfaces frequently touched is a good thing, such as microwaves, door handles, fixtures, countertops, phones, copiers, etc. Printers for that matter. Hold the inside of your elbow to your mouth, all right, to cover coughs and sneezes to stop the spread through the hand contact. Try to cover your nose and mouth with a tissue when coughing or sneezing and properly dispose of the tissue immediately after use. If you develop symptoms, call your healthcare provider. He or she will determine whether you need to be tested. So, the thing, if you're sick, stay home, distance yourself, soap and water, sanitize. That would be my message on COVID-19. Take care, everyone, and make good choices and be safe.